finally pooed a little bit. Yay! So today I pretty much feel like I felt yesterday. The only sort of discomfort I have is from how high up the bandages go under my arms here. When I put my arms down, they bunch up really weird in my armpit and it rubs on my skin awkwardly and it doesn't feel too good. And then the tape underneath here is pretty itchy. And then my stomach, even though I went to the bathroom a little bit, I think from all the medication, I'm still a little bit bloated, which is uncomfortable, but everything else feels fine. The bandage, the tightness from the bandage actually feels really good. It makes me feel safe, secure, like my insides aren't going to fall out all over the place. For those that aren't familiar with this procedure, double incision, basically what Dr. Garamoni does is he cuts above the chest and then below the chest and then takes that out. So that's where the double incision part comes from the two incisions up top and below. Takes out the middle skin, the nipple, the areola, all of it, and he sews that together. And then he takes the areola and the nipple and he sizes them to be proportionate to your body, and he places it on the outside of the pec muscle, and then obviously that's done on both sides. So I'm going to show you kind of what's going on here. So underneath this I have there's like gauze over top of what's going on under there on my pepperoni nipples and my incisions, and there's surgical tape over the incisions, and then there's like the gauze and then some sort of padding, I believe, and then it's wrapped up with ACE bandage, and there are drain tubes, these fun little blood grenade things. The tubes go in underneath my armpit, and the tube snakes up into my chest, and it's sucking out any extra fluid that may be building up in my chest. You know, the body recognizes that there's now a cavity there and it's trying to fill it up with something. So these are getting rid of that something. I don't know if you can see it on the camera, but you can see where they shaved my chest and my stomach a little bit, and I had to shave my armpits, but I missed quite a huge spot. So way to go, Ray. I had somebody ask me a little bit about the $400 fee that I was talking about in my pre-op video, and I wanted to explain that a little bit more. So I guess what had been happening is the hospital, the surgical center, not Dr. Garamoni's office, had been billing patients for pathology. So basically, they were billing you to dispose of your fat tissue, and they had been billing the patients directly, and it was a variation of charges between $400 and $600. So Dr. Garamoni's office said, no, we know it costs $400, so we will take care of that fee and then we'll give it to you. So Dr. Garamoni's office, as of 2 weeks ago, has started to collect that $400. So if your surgery, if you go to schedule a surgery, I'm sure they'll tell you about that, and it won't be sprung on you last minute like it was with me, unfortunately. You know, but I am happy that they are taking the responsibility of charging for that pathology fee, because like I said, they're making sure that it stays at $400 and is not becoming outrageous. I have some friends here with me and they're telling me that I'm moving around too much, so I should probably stop listening to my head saying that I feel fine, because I'm sure it's just the medicine, and I should probably stop moving around so much. It's so weird to look in the mirror and see the bandages and the drains, and it's just so weird that I'm now that guy in the post-op video. It's just so surreal, and I know I'm using that word a lot in the past few videos, but I just feel so incredibly blessed and so ridiculously happy. I just feel awesome. I feel fantastic, and I can't wait. I cannot wait to see it. So yeah, this is me 2 days post-op. So I'll probably be back tomorrow just to do another little check-in, because it'll be my birthday. Yay. 23 years old. and 3 days post-op. So I'll see you tomorrow. Have a good day.